Hi, Louis. I am Dr. Betty. It's nice to meet you.
It's nice to meet you too.
Today we are here to talk about your son David's hearing impairment and further management for it.
This would be really helpful to our family. We are all depressed and sincerely need advice for giving him confidence in a better life.
Hearing impairment can be caused in different ways. Age, long-term exposure to environmental noise, genetic, disease or illness, medications, exposure to ototoxic chemicals and physical trauma are all possible causes. David's was caused by a head injury in an accident. There can be damage either to the ear itself or to the brain centers that process the oral information conveyed by the ears. It was fortunate that his brain was not injured, otherwise there might be malfunction other than that.
Actually, he didn't become deaf. He has minor hearing, it's struggling, but he still hears and speaks.
I am glad to hear that. Since he developed a hearing problem in his teenage, he would not have significant vocabulary issues in reading, neither communication skills. We call it postlingual hearing loss. People with postlingual hearing loss face their own challenges, living with the adaptations that make it possible for them to live independently. They may have to adapt to using hearing aids or a cochlear implant, develop speech reading skills, and/or learn sign language. The affected person may need to use a teletypewriter, interpreter, or relay service to communicate over the telephone. Loneliness and depression can arise as a result of isolation from the inability to communicate with friends and loved ones and difficulty in accepting their disability. The challenge is made greater by the need for those around them to adapt to the person's hearing loss.
I know as family we need to pay more attention and patience.
Many relationships can suffer because of emotional conflicts that occur when there are general miscommunications between family members. Generally, it's not only the person with a hearing disability that feels isolated, but others around them who feel they are not being heard or paid attention to, especially when the hearing loss has been gradual. Family members then feel as if their hearing loss partner doesn't care about them enough to make changes to reduce their disability and make it easier to communicate. That's on the emotional side of management.
Yes. What physical treatment or assistive technology can I give him to make it better?
Hearing aids, which amplify the incoming sound, may alleviate some of the problems caused by hearing impairment, but are often insufficient. Cochlear implants artificially stimulate the eighth nerve by providing an electric impulse substitution for the firing of hair cells. Cochlear implants are not only expensive, but require sophisticated programming in conjunction with patient training for effectiveness. For assistive technology, there are a bunch of options to accommodate different needs. Many hearing-impaired individuals use assistive devices in their daily lives, real-time text, instant messaging to avoid distant voice communications, as well as video phones, video relay service and video remote interpreting to allow sign language interpretation.
Thank you so much, Dr. Betty. You helped me a lot figuring out what I can do for David.
You are very welcomed. I wish David will get in on track soon.